No tenderness.
Okay, no tenderness of the sinuses. Now going to palpate down the bridge of the nose. Once again, let me know if there's any pain or tenderness. Okay, no pain or tenderness of the nose. There's no swelling, no abnormalities, no masses or nodules of the nose. I'm going to have you occlude one nostril at a time and breathe in. Breathe in. Okay, the nostrils are patent bilaterally. I'm going to go ahead and move on to my assessment of the lips. So just looking at the lips, they are symmetrical, they are even on both sides, they are pink, consistent with ethnic background, and they are moist. There's no lesions or cracking, and there's no lesions of the nose as well. I didn't say that. I'm going to go ahead and now look at the inside of the mouth. If you could say ah for me. Okay, the pharynx is pink and moist. I'm gonna go ahead and have you say ah again. Okay, the uvula is pink and moist, it's midline and it rises with phonation. The tonsils are pink and moist. There's no lesions, cracking, or abnormalities on the inside of the mouth, and the tonsils are grade 1. I'm going to look at the buccal mucosa and the floor of the mouth. Okay, the buccal mucosa is pink and moist. The floor of the mouth is also pink and moist. The tongue is midline, pink and moist. There's no abnormal growths. There's no lesions. There's no abnormalities on the inside of the mouth. I'm going to go ahead and look at your teeth and your gums. Okay, the gums are pink and moist. There's no lesions, abnormalities, cracking, abnormal growths. The teeth adhere to the gums and they are white and straight. And then if you could open your mouth. And there is no dental caries on the teeth. All right, I'm going to now move on to my assessment of the eyes and ears. So in practice, I tested my patient's distant visual acuity using the Snellen chart. It was found that at 20 feet away, the patient could read, and the patient was 20/20 vision in the right, left, and both eyes, and this is cranial nerve number 2, and it is intact. I also tested my patient's near visual acuity using the Rosenbaum test. This is newspaper print. Read at 14 inches away, the patient was able to read. They had 20/20 vision in the right, left, and both eyes with no visual aid, and this is also cranial nerve number 2, and it is intact. I'm going to now test the extraocular eye muscles. If you could follow my pen, just with your eyes and not with your head. Okay, the 6 cardinal fields of gaze are intact. This is cranial nerves number 3, 4, and 6, testing the extraocular eye muscles. I'm now going to look at the eyes. If you could pull down your lower lids. Okay, the conjunctiva are pink and clear. The sclera is white. The corneas are clear, bright, and smooth. The irises are brown. The upper and lower lids have no edema or redness or swelling. The eyebrows are evenly distributed and they are brown and they are symmetrical, and then the eyelashes curve upward and outwards and they are also evenly distributed. I'm going to go ahead and put on gloves now and palpate your eyes. So I'm going to be palpating the lacrimal gland, the upper and lower lids, as well as the eyebrows and the bony orbit. Let me know if there's any pain or tenderness when I do so, okay? Oh, you can close your eyes. Okay, that lacrimal gland, upper, lower lids, eyebrows, and bony orbit. Is there any pain or tenderness?
No.
Okay. There is no drainage from the lacrimal apparatus. There is no edema, redness, or swelling of the upper and lower lids, and there is no tenderness throughout the eyes. So I'm now going to be looking at the pupils. I'm going to be checking perla, which is cranial nerve number 3. I'm going to first measure them. They are about 5 millimeters in diameter. They are equal and round. I'm going to shine this light in your eyes real quick. You could look at me.
If I was assessing respirations, I would assess respirations for 30 seconds, watching the rise and fall.
Okay, the pupils are reactive to light, and I'm going to have you look at the pen, look at the wall behind me, look back at the pen, and look at the wall behind me, look back at the pen. Right, and they are accommodating, so this is cranial nerve number 3, and perla is intact.